Good afternoon. I'm Linda Jensen. I am the Education Director for the Arizona Housing Coalition, and it is my pleasure to welcome you to our webinar. We are talking today about access to benefits. In July, we started a series called The Art of Case Management, and we would like to continue that series talking about the kinds of things that make life easier for case managers, make your jobs more effective, make your clients more successful. And today we continue that series with the kinds of answers and information that you said you were looking for, which is accessing benefits that are available to your clients and knowing how and where and when to connect clients. So I wanted to let you know that this is part one of a two-part series. We are going to do a follow-up in December where we start talking a little bit more about navigating health plans. So if we don't get to all of your questions today about health plans, know that there's going to be a follow-up in December where you're going to have an opportunity to ask those questions. And when we do the follow-up email, I'll make sure to include the registration link for that webinar. So today's format, again, is webinar, meaning you can see and hear us, but we cannot see and hear you. So your means of interacting with our panelists is via chat. We welcome your questions in the chat, and after the presentation part of the webinar, we'll get to as many of the questions as we possibly can. And then if we don't get to all of them, we'll have an opportunity to connect you to resource people afterward. So with that, I am going to turn it over to today's moderator. From Mercy Care, we have Andy Wambach, who is going to facilitate our conversation.
Thanks, Linda. Hey, everyone. Super excited to be a part of this Art of Case Management series that the coalition is putting on. Obviously, case management nowadays is probably more challenging than it ever has been. But that also includes a number of resources to be able to connect to, but also to learn and understand. So I think today is a really great conversation around just how to connect to those benefits, and then also what's the eligibility around them and kind of some of the finer details of those. So today, as Linda mentioned, I'm just going to be moderating our conversation, but joined by our two subject matter experts, Christopher Sisson with DES, who is a project coordinator on the benefits side over there, as well as Julie Swenson, Access Senior Policy Advisor. So they have a great presentation lined up for you today. Again, feel free to utilize the chat, and I'll be monitoring that, and we should have plenty of time for questions at the end. With that, I'll pass it off.
Get away, Chris. We're ready for you.
Oh, okay, then we'll start with the slide presentation then. And so I wanted to talk a little bit about, this is kind of a high level overview, not getting down into a lot of depth, but kind of things to look at in terms of connecting with the program. First off, talk about how you can go about applying for program benefits. I'm with FAA, and the programs, Family Assistance Administration, and the programs that we administer are what we call nutrition assistance in the state of Arizona, which federally is known as the SNAP program. We also determine eligibility for temporary assistance for needy families, TANF, cash assistance, and for a lot of the categories of the Access Medicaid that Julie works with a lot. So in terms of the ways that you can apply for benefits to see if you're eligible, there's a lot of different ways. There's the website healthyarizonaplus.gov, the customer portal there. Customers can complete an online application and submit it. You can get help from an HEA Plus assister. Customers can complete an interview by telephone by calling 1-855-HEA Plus, or the numbers are there if you prefer to get the numbers, the actual numbers. And that telephone line is open to provide assistance and complete interviews weekdays from 7 in the morning till 6 p.m. in the evening. You can apply in person at any DES Family Assistance Administration office that accepts customers. The reason I say that is we do have some offices that are strictly call center environments that don't handle in-person traffic through the lobbies and that type of thing. You can also download an application form, and you can send the completed form in by either US mail to that address there on the screen, or by fax to the fax number given there. And then there's an additional way that customers can submit an application that I learned about while I was preparing for the presentation. We have a wonderful thing called the My Family Benefits portal, myfamilybenefits.gov. The customers can, if they create an account on that website, they can log in, they can download the actual official application form, complete it, and then by uploading that application form can submit the application to DES without having to come into the office, or and it's the paper application format. So, okay, the next slide. So I wanted to talk a little bit about some of the community outreach efforts that DES has. We have an outreach program. We call it DES on the Spot. Internally, we refer to it as DOTS. And what that consists of is we actually have staff that normally work in the local offices that go out to physical locations and are available on site at different social service locations. I kind of made a list of the current locations where we do have on-site staff availability. And just to review some of them, and you had the address and the service hours there, but most of these locations are within Metro Phoenix and Tucson areas. But we have Canyonlands Healthcare, the Phoenix Rescue Mission, the Human Service Campus, which is a location in Phoenix that has a lot of different organizations that are available there. We have Justice Center, LifeWell Behavioral Wellness, and next slide. We have Native Health, Ozanam Manor, which is administered by St. Vincent de Paul. We have the Parsons Family Medical Center. We have the Phoenix Rescue Mission, Transforming Lives Center, the Society of St. Vincent de Paul, and the Town of Guadalupe offices, Tucson Community Food Bank, US Vets, and Valle del Sol. And you can see the, like I said, we're probably going to send these slide decks out to make it available to everybody, so you can have that to capture the exact locations and the hours and that type of thing later on. So next slide, please. I wanted to talk about My Family Benefits. It's a real excellent resource for any individuals that do have access to online. It's a customer portal that's available in both English and Spanish, and allows customers to do all the following for their nutrition and cash assistance benefits. They can track the status of their application. Once the case has been approved, they can view the status of their case and the benefit amounts. For the nutrition assistance or SNAP program, a lot of our customers are required to complete what they call the mid-approval contact. What that is, we're giving a longer approval periods these days, typically 1 year, sometimes 2 years approval periods. So according to the federal regulations, they require the participant to contact the state agency at the midpoint of that approval period. So just like for people with a 12-month approval period, like at the 6th month, go ahead and contact us. Let us know if there were any critical changes that might affect eligibility. And then the same way for a 2-year approval period, they would contact us at around the 1-year period. Report any using My Family Benefits. They can report any changes in their circumstances. And I think what's a really cool thing that they can do is upload and view documents that are associated with their case. And they can also manage their communication preferences on My Family Benefits. If you're like me and you don't like getting a lot of paper letters, you can choose to go paperless, and you can receive communications through email, text message, or both. Next slide. I wanted to take a minute to talk about what we call expedited benefits. That was one of the discussion points. One of the questions is, how do you get qualified for expedited benefits? So for expedited nutrition assistance, there's specific criteria that the federal government lays out. And the advantage to being classified as being eligible for expedited services is that people that are eligible would receive their benefits within 7 calendar days from the application date. And in order to be eligible for the expedited services, it's basically a financial determination. There's 3 different separate criteria. If any of these criteria are met, the person is potentially eligible for expedited services. We look at the gross countable income for the application month. And if it's less than $150 for the month, and liquid resources such as savings accounts, checking accounts are $100 or less for the month, they would be eligible for the expedited services. Destitute, as defined by program rules, or a seasonal farm worker is included in the application. The liquid resources are $100 or less. And then the last bullet point is probably where most of the people qualify for expedited nutrition assistance benefits. So we look at the gross countable income expected to be received in the application month and the amount of liquid resources the person has. And then we compare that to the monthly rent or mortgage amount plus the appropriate utility allowance as defined by the program. So when I say utility allowance, of course, the program defines what they're going to allow for a utility allowance. So we apply the figures that the program provides, and those are adjusted annually based on surveys of utility costs and everything in Arizona. So, for example, a standard utility allowance is for households that have a obligation to pay for heating or air conditioning, cooling, heating or cooling. So that utility allowance would be $318 if there's 1 to 3 persons in the household, and it goes up to $431 if there's 4 or more individuals in the household. And there's a lower figure for what they call a limited utility allowance, which is basically when somebody has to pay utilities, but they don't have an obligation to pay for their heating or cooling costs. For instance, I might have a water bill and I might pay for my cell phone, but I don't have any other utility obligations. That would be an example of the limited. And then there's a final lower utility allowance for somebody that just has a telephone obligation. So one of the other benefits in addition to getting the benefits a lot faster, the mandatory proof may be postponed. The only thing that can't be postponed is identity of the person that's applying. Next slide. Oh, I wanted to mention too that the normal time frame for processing for people applying that do not qualify for the expedited processing, the normal time frame is 30 days. That doesn't mean that we try not to take the full period of time, but it can take up to 30 days to have an eligibility determination made for the non-expedited services. What I did want to say too about the expedited benefits, what happens with those is if somebody that is eligible and they apply on or before the 15th of the month, if the verification gets postponed, they would just get the prorated month of application benefits. However, if they apply after the 16th or on or after the 16th of the month, they would get both the prorated amount plus the following month. So in those kind of situations, we tell our caseworkers to advise people that are receiving the benefits to, if they get the prorated amount and the full amount at the same time, you know, to kind of consume them, because it might be a while before they get the next month's benefits, because we can't issue the third month of benefits until everything's been verified that's required. I'd like to talk about for our customers that have been involved with the Arizona Department of Corrections, Rehabilitation and Reentry. We do have some special programs, pre-release programs, to help those individuals transition back in. We call it it's the Resource Employment and Development, or RED, Reentry Program. And FAA does accept applications from the following facilities: Safford, Yuma, Lewis, Perryville, Tucson, Winslow, Douglas, and Phoenix and Iman. Individuals that graduate from the RED program are given a telephone number to a specialized unit to complete the interview. They do not have to go through the main customer care center or visit a local office in person. In addition to the potential nutrition assistance benefits, the RED program also provides 90-day post-release transition services. And I think we have a video addressing that in our resources slides at the end of the presentation. Next slide.
Like I'm up next.
Now it's your turn.
Now it's my turn. And well, all of that information on how to apply generally applies to the access programs, as well as there's a few extra pieces that I am in a place to give you a little more detail about. So let's talk about Healthy Arizona Plus sister organizations. We mentioned them, and these are community partner organizations. They use our Healthy Arizona Plus eligibility system to help Arizonans apply online for access, nutrition assistance, and cash assistance. And currently there's well over 200 sister organizations across Arizona. We did provide some links within a resource page, and there are instructions for finding a community partner, HA Plus a sister organization nearby. And one of the key things that we like to mention about community sister organizations is they're not just medical organizations, they're not just food banks, they're a number of community-based organizations and other entities. And there are benefits to becoming a community partner, a sister organization. There's the personalized support to your customers in your community. They can help customers apply for multiple programs in one process. There's real-time electronic verification of many eligibility factors. So when applying for benefits, a person might, think, what do I need to, what kind of proof do I need for these factors? When going through a community assister, they'll find out what we were able to verify right up front through our electronic data source matches and what may still be needed, so that we can avoid the wait for an email or regular snail mail on what do you still need to provide. So you get that right up front, very rapid, expedited information about this is what I might qualify for, and these are the proof elements, if any, that I need to provide. Because in many cases, we are able to adjudicate the case, process it in real time. That the system will automatically process eligibility if certain criteria are met, and we have enough information from our electronic data sources. It also, if the customer does need to submit application documents or proof, that can be done quickly and securely through an upload process. Community assisters can track the application status of their customers that they work with and the results. There's also a dedicated call line to help resolve problems with applications. So while these are all things that apply to community assisters, but if there are any entities out there that would think that this would be a good way to help with case management, this is available through a fairly straightforward application process. It takes a community partner application form. It's not particularly burdensome. It does require a partner agreement because we are talking about a public benefit program with protected information, and individual user application forms. So the people that would actually use the system to help people apply need to have an individual affirmation form. The training is simple, straightforward. We provide that and we get people up and running. And I provided a link also to the Community Partner Sister Organization program page. That's more information. If anybody's interested, that particular page gives a lot of details on getting started and next steps. So because we had questions about, people transitioning from justice, I was really excited about the information that Chris provided. I wasn't aware of that from the DES side. I know that they have programs, but didn't have a lot of details. Access has been working on programs related to justice involved members and transitions out of custody for many, many years. And we have some very specific programs and initiatives in place that are helpful to know about when you're dealing with people that are about to be released or have been released. So when we have an Access member who is detained, and I'm going to talk about adults because there is a very different process for juveniles that's a little more flexible, honestly. We suspend their incarceration automatically through daily match files with the detention entity, but we also use their same daily match files to reinstate them upon release. So just because somebody's been in a detention facility, it doesn't mean that their eligibility was lost. In the past, it would have. But for several years now, we have had a suspension process implemented that when possible, when we're notified, we're able to suspend that eligibility, which really rapidly allows for reinstatement of the enrollment and access to services very quickly upon release, normally within 72 hours. And that is the outside marker. Some of them are within 24 hours or less. We also have 13 integrated clinics that are located with or adjacent to probation and parole offices. And by integrated, I mean they have both physical health and behavioral health services available to the targeted justice involved populations. And there's also a care coordination for Access members that were suspended and they're releasing from incarceration. There's a special process for individuals with particularly complex or high risk diagnoses or conditions to start that care coordination and get appointments set up prior to their actual release so that they are ready that the day they're released to have an appointment if needed. And then there's a more general pre-release process that we have set up with the state, what are they now? The Department of Corrections.
Yes,
something in reentry.
I have it here in my notes.
Thank you.
Arizona Department of Corrections, Rehabilitation and Reentry.
Thank you. Rehabilitation and reentry. That was a new acronym for me, so I'm still learning it. But we have this pre-release process where they can act as a sister organizations themselves, apply with the customer's consent, but they help them make the application, provide any proof needed to get their eligibility ready to roll so that when they are actually released, they confirm the release date and we are able to process that real time. And we usually have eligibility and enrollment in place within 24 to 72 hours for that process as well. And then finally, just because this is the one program that Access administers completely, we administer the program from beginning to end, and it is also a slightly different path to accessing these benefits. The Healthy Arizona Plus system has a customer portal for all the other programs. The long-term care system program is incredibly complex, and rather than providing a a very long and difficult application, whether it's online or by paper, we provide an abbreviated application form that the person just basically is signaling, I want to apply it. It preserves the application date. And then they do a financial interview. 99% of the time that's done over the phone, unless there is a need for it to be done in person. And that's usually at the customer's request, where one of our staff from the Altex program walks the customer and or their representative through the application process. They ask the questions, they explain questions as needed, and they help the person understand next steps and any proof that they need to provide. And it can be that process, it can be started by phone or by submitting an abbreviated request for application form. And I'm pretty sure I have a link to that part of our website in the resources. And there is a two-part assessment. There's financial eligibility and the medical assessment for the level of care needed, because Altex is a program for people that need basically a skilled nursing facility level of care. They can receive that care at home, but without that care, they'd be at risk of being institutionalized. So those are kind of the three access-specific paths and exception programs. Let's move on. Chris, you're back up.
Okay, so let's go to the next slide then. Just to talk a little bit about the nutrition assistance eligibility factors. Now there's some here that you know, there may be additional factors depending on the actual case circumstances. I just kind of hit the highlights of the ones that kind of apply to everybody that's applying. Of course, we have to verify the identification of the person that's submitting the application. And if there's an authorized representative being utilized, we have to verify their identification as well. For individuals to receive benefits, they have to meet the U.S. citizen or the qualified non-citizen categories. Of course, you can imagine the qualified non-citizen categories get very complex. But in a lot of cases, there's like a 5-year waiting period from when the person arrives in the U.S., that kind of thing. So, however, I need to mention at this point too that just because an individual doesn't meet the U.S. citizen or qualified non-citizen category, they can still apply on behalf of other people who do. So, and then again, also to receive benefits, the person needs to either provide their Social Security number that they already have, or apply for a Social Security number. There again, if the person's not going to receive benefits, then they can apply on behalf of other people that do have a Social Security number, and they don't have to. You know, we would not expect them to meet the requirement for the Social Security number themselves. For most households that are, for the most households, if the household doesn't include somebody that's 60 or over, or somebody that has a disability as determined under the federal program guidelines, they have to meet the gross income test. So the gross income test for SNAP or nutrition assistance is under 130% of the federal poverty level.